Hundreds of doctors and other top medical providers at Allina Health are preparing to vote to unionize. If successful, it would become the largest private sector healthcare union in the country.
Fox 9's Rose Schmidt tells us they're taking this rare step because they feel the healthcare system is broken. So what did they have to say today, Rose?
Well, Kelsey, Randy, these providers tell us they're constantly being asked to take on more patients as families struggle to book checkups. At the same time, they say layoffs and staff shortages have led to their clinic staff doing, in some cases, quadruple the work.
We aren't fearful anymore because things can't get any worse.
A year ago, this group of white coats from Allina Health didn't know each other, but they bonded over reaching a breaking point.
It's almost like we've become kind of an assembly line of care, and it doesn't really matter who does it. We're all interchangeable.
Now, more than 500 providers across 56 primary and urgent care clinics are organizing. These doctors, nurse practitioners, and physician assistants have been clear. Their desire to unionize isn't about money. It's about fixing a system that only got worse during the pandemic.
A big problem is people are getting burned out. People are leaving medicine. People are cutting back their hours, which is terrible for the system because we can't accommodate the patients now.
People can't get checkups. People can't call a clinic and ask to get a new doctor because they just moved to town. There's clinics where they're having to shut the lab services down before the end of the clinic day because we don't have people to draw the blood.
A lack of support staff means doctors are using personal time to respond to what they call an implosion of medical messages and phone calls. They acknowledge they're worried about the future of primary care and want to have a say in decisions involving their patients, even as far as billing and insurance companies.
We see patients every day. We know what our patients need, but we've really not been given the chance to advocate for them.
The union election is expected in the coming weeks. If their efforts are successful, they would be joined by 140 doctors at Allina's Mercy and Unity hospitals who voted to unionize back in March, but argue their employer has refused to recognize their union. Allina Health sent us a statement saying in part that it wants to identify ways to increase provider engagement through operational improvements, new communication tools, well-being resources, and enhanced employee benefits to improve their experience. In the newsroom, Rose Schmidt, Fox 9.
All right, thank you.